News 46. Local coverage you can count on.
Happy holidays from your Pahrump Healthcare Partners Medical Group doctors and staff. Quality care with doctors you know and trust, right here in Pahrump.
Happy holidays!
So cardiology, that's the heart specialty. We attend to all the issues of the heart, from congestive heart failure, electrical disorders, chest pain. We do stress testing. We have two locations in Las Vegas, one in Rancho and Charleston, one in Siena Heights, where we see patients on daily basis, Monday to Friday. We do all kinds of outpatient testing, including echocardiograms, stress tests, treadmills, monitors. We see patients right now once a month in Pahrump, and we have a lot of our patients in Las Vegas who actually in Pahrump who drive all the way from Pahrump to see us in Vegas. So we're trying to make it easier, especially for the seniors who probably constitute more than 70% of our patients, so that they don't have to make this drive. So we're trying to come to them here, to their location, in this community, and make it easier for them. In the future, we're planning to get more busy, and hopefully we'll get more testing done here, so that we can be more helpful to the local community.
It is really important, especially if you're having possible problems with your heart, that you can do this locally here. So you're coming out personally here, and we can test people right here in this facility on Calvada?
In this facility right now, we have an echo machine, which is, the echo is the ultrasound of the heart, which gives us very good information about the heart muscle function, about the valve function. And we have a basic treadmill stress lab. We don't have the camera, the nuclear camera right now, so if the patient's condition requires a full chemical stress test, including nuclear imaging, we send them to Vegas right now. But there is plans also in the future for an e-visit, where, for example, a lot of our patients sometimes have phone calls, they have certain issues. So with the e-visit, the concept is that the doctor can look at the patient, we can even listen to the heart with a special stethoscope that can transmit the sounds to us, to the office in Vegas. So I can be sitting in my office in Vegas, and Mrs. Williams, or sitting here right here in the office, asking her about her questions and listening to her heart from Vegas without her having to drive all the way. So that's in the works as well.
Amazing.
Yeah, absolutely. So
it's fantastic. What a great thing. So tell me a little bit about, do people need to go through their primary care physician to see a cardiologist, or can they just come into SouthWest Medical and ask to see one?
At this point, the way our system set up is that we need a referral from the primary doctor. I mean, basically everybody has to have a primary care doctor for so many other factors. So at this point, as long as they have a primary care doctor, they just need to put a referral in the system. And we're very accommodating. I mean, we don't have any special, anybody who has any heart issues should be able to see us. So that shouldn't be an issue.
So do you do preventative as well as, treatment?
Absolutely. I mean, me personally, and I think the whole department, our focus in cardiology is on prevention, by controlling the risk factors, the cholesterol, the blood pressure, the lifestyle issues, not smoking and exercising, promoting those factors. For me personally, I focus on that more, because I'd rather deal with those issues before getting to the blockage and to the stent and the weak heart muscle and the electrical disorders. So, but if you already have those issues, some patients have those issues already, we deal both. So we focus on both.